The second enrollment period begins Saturday for people buying their own health insurance under the Affordable Care Act. Sign-up season lasts until February 15th, but customers must sign up in the first month for coverage that begins on January 1st. The exchanges are intended for people who don't have access to affordable coverage through their jobs. Below are 5 things that South Carolina residents should know about the insurance that is available through President Barack Obama's signature healthcare law. How many have already signed up? More than 118,000 people in South Carolina have signed up for ACA plans during the previous enrollment period, and navigators hope to double that number during new enrollment period. According to the Centers for Medicare and Medicaid Services, about 7.1 million people are enrolled in and paying for insurance through state and federal exchanges. Of those, federal officials estimate that about 5.9 million would re-enroll for 2015. The U.S. Department of Health and Human Services has not issued state enrollment projections, but has estimated that at least 9 million people will be enrolled nationwide in 2015, well below the 13 million that the Congressional Budget Office has projected. During the last enrollment period, federal officials said nearly 214,000 South Carolinians filled out applications for health care, but about 45% of them didn't complete the process and pick a plan. Nearly 90% of the people who enrolled here were eligible for government subsidies for the private insurance. 2. Who's offering insurance in South Carolina? Blue Choice Blue Shield and its licensee Blue Choice, as well as the health insurance cooperative Consumers Choice, one of 24 nationwide created by the federal law, offering plans statewide. Coventry Healthcare, which was bought last year by Aetna, is also offering plans. A 5th company, Assurant Health, is joining the exchange for the coming cycle. 3. Pricing information. Before Saturdays, customers can enter their age, location, and income on www.healthcare.gov to see estimates of how much plans from each insurer would cost. State officials have said they expect prices to increase by around 1% for most customers, and prices are affected by factors like age, income, smoking, and location. A report by the Federal Department of Health and Human Services found premiums in South Carolina to be higher than the national average in 2014, measuring at an average of $260 a month with the least expensive bronze plan. Nationally, the average for the lowest cost bronze plan was $249 a month. 4. What about the website? The Federal Exchange website, used by South Carolina and other states, has been upgraded and rebuilt in hopes of avoiding the glitches that marred last year's rollout. Officials have also streamlined the application for most first-time applicants, paring down the number of screens. Returning customers have until December 15th to update their financial information in their existing accounts for coverage. Starting in January, those who do nothing will be re-enrolled in their current plans, along with the subsidy amount they got for the first year. People who wish to keep their plans that predate the ACA can continue to do so after the Obama administration allowed an extension. Wow, how nice of him. 5. Getting help. People who want to find counselors to help them through the sign-up process can enter their location online at localhelp.healthcare.gov/. The federal government is giving community groups funds to send people trained to navigate enrollment to churches, libraries, and local festivals. The cooperative ministry, which has a navigator grant through the end of the year, is open Saturday to help people with enrollment. Blue Cross Blue Shield, one of the state's 5 providers, is holding agent open house sessions around the state this month and also has 2 mobile units where enrollees can sign up on the go. Wow. Well, perhaps people aren't signing up because it's too expensive and they know they're getting screwed and they're getting very little for their money. A couple of things come to mind. My health insurance, the first few years that I had my plan, it was a $350 deductible. And then this year, big surprise, without any warning, it jumped to $420 deductible. I had no idea. And then next year, there's talk of it going even higher. But I looked over at another website, Blue Cross parent offices, and executive paydays. Now this article was taken in 2012, written in 2012, but the unbelievable amounts of money that these insurance companies make, and I'll just read this little executive paydays. Healthcare Service Corp. CEO President Patricia Hemingway Hall's total compensation in 2011 was in line with pay for top executives of other big health insurers. The CEO compensation for the largest health insurance companies by revenue. David Cordani, Cigna Corporation, total 2011 revenue $22 billion, and it looks like he gets $19.1 million of that. Stephen Hemsley, United Health Group Incorporated, total 20 revenue $101.9 billion, and he gets a whopping $13.4 million. Third is Andrea Braley, WellPoint, total 2012 revenue $60.7 billion. She gets a whopping $13.3 million. Patricia Hemingway Hall, Healthcare Service Corporation, total 2011 revenue $49 billion, and she makes $12.9 million. Mark Bertolini from Aetna Incorporated, total 2011 revenue $33.8 billion, and he makes $10.6 million. And then there's last Michael McAllister from Humana Incorporated, total 2011 revenue $36 billion, and his salary is $7.3 million. Are you kidding me? Are you kidding me that these people make this kind of money, and then the government can't even get a website up and working right? They take the personal out of these websites. Geez, when are we going to wake up and